Well, hello everyone. Welcome and thank you for joining this Share4R webinar. My name is Suzienne. I'm working for the World Duchenne organization, who is one of the project partners, and I will be your host for the upcoming webinar. Today we will learn about state-of-the-art rare disease activities and how you can apply these best practices in creating your own. And for this, we're inviting another partner to share their experience when it comes to organizing these state-of-the-art activities. So for this webinar, we've invited Victoria Hadley and Hannah Murray from the John Walton Muscular Dystrophy Research Centre at Newcastle University to talk about this. But first, let's talk you through the agenda. So here you can find the agenda. First, we'll do a short introduction on the Share4R project and its goals and how we are creating this global and safe rare disease community where families are empowered to participate in research projects. And then I will hand over the talking stick to Vicky and Hannah, who will present the research and will guide you through these 10 years of research about rare disease activities and give you guidance on how to apply these insights. And then we have some time for some questions and discussion. So during this webinar, you will be muted, meaning that if you have a question or a comment, you can use the comment box for this. And you can access it by clicking on the speak bubble in the top right corner. So from these questions or comments, we will guide the discussion after the presentation. So please use this comment box as a digital chat room so we have some input. Just for the record, this webinar will be recorded and made available on our YouTube channel. You can check this recording out together with previous webinars on a channel called Share4R. So with this all in place, I'd like to tell you a bit more about the Share4R project, because we are a European funded project to make really a difference in rare disease research. And we do that by creating an online community to boost research on rare diseases. And in this community, we have patients and carers and clinicians and researchers joining forces to do research that matters to patients. And we're doing that because we see many challenges during these rare disease times where families are having troubles. So one of them is that it's incredibly difficult to drive a research project affecting such a small number. It's really hard to attract awareness on your condition, and researchers are less likely to engage in a small number of research. And next to this, it's also hard to find information that's reliable, that's true, and that's up to date on your rare condition. And all these factors contribute to people having the feeling that they're alone in this, and some are facing psychological issues such as isolation due to this. And because of these conditions being so uncommon, the chances that you live close to another person that has the same condition is, well, practically even more rare. And this requires a level of international collaboration if we really want to improve the understanding of rare diseases. And we also want to speed up time to diagnosis by pushing research, because so many families have spent years trying to find out what the condition is before you can start with possible treatments. Because, after all, you can't treat what you don't know you might get. And one of the last challenges rare disease families face is the lack of natural history. And it's nearly impossible to provide advice to patients and families about the natural cause of the disease, as we don't have enough data for this. So families are unable to prepare for what the future might bring. So in Share4R, we're using the power of computational power of rare disease platforms to connect rare diseases and families and empower them to participate in research initiatives. And our aim is to build the largest virtual community to promote the donation of clinical information on rare diseases based on patients and caregivers. And we do this by sharing trustworthy and up-to-date information. So when you go to Share4R, to the library, you see all these medical chapters that contain information about the condition, about the diagnosis, about possible treatments, and all of these are written in an understandable format by an expert on the condition. So it's definitely worth checking out to see if your knowledge is up to date. And well, as the name says, we also aim to share. And here you can see a visualization of all the people in the platform. And it kind of looks like a web, but you can see that there are some people, some users of the platform that are closer than others. Because when you register in the platform, you have the chance to answer questions on your condition as well. And based on that, an algorithm calculates which persons you are close to in terms of your condition, in terms of your geographical location, or in terms of your symptoms. And even in this way, even undiagnosed patients can find people like them connect with them in a secure environment. And next to connecting to other people affected by the same conditions or symptoms, you can also find and reach out to a patient organization that is close to you, which can provide you with more information about the condition. And these are the 4. We also have research, which is one of the last 3 pillars of Share4R. So we're currently running 4 research studies where we collect information about the natural history and the conditions of the symptoms, and for example on patient-reported outcome measures, and all is to increase understanding of these conditions. So these are the 4 projects and their goals. So the first study is that we want to create a better understanding of the natural history in pediatric rare tumors. Secondly, we want to study the long-term effects and the treatment of acute lymphoblastic leukemia when the onset is pediatric. We also have a third pilot to understand how having a neuromuscular condition impacts learning and work opportunities for patients and carers. And we launched a 4 research study to improve understanding on the needs of undiagnosed patients. Now, if your child or you're caring for somebody affected by one of these conditions or had not been diagnosed yet, register in Share4R so you can participate in this research study designed for you to help create a better understanding of your condition. And to ensure safety in the platform, we've built in some additional steps. So once you are validated, you can either go to the platform to ask questions or participate in the discussion, or you can also complete the study questionnaires. So you have to be registered and validated in order to participate in these questionnaires, but it might look like an extra effort, but it protects you as a patient or a carer, and it also validates the quality of the data that we're collecting. So that was Share4R in a nutshell. Should you have any questions, just ask it in the comment box or send us an email at info@share4r.org. And it's important to know that next to driving research, we're also joining forces with all our project partners to strengthen the voice of rare disease advocates, because you need to create awareness and noise to be heard and set things in motion. And one of the things by doing so, and by creating knowledge, is by creating an activity or an event. So this is why 2 experts are going to tell you everything about state-of-the-art rare disease activities. So this is a research providing information for all stakeholders in the rare disease field, and it will explain how each country is tackling this rare disease challenge. Now from Newcastle, we have Victoria Hadley, who's a rare disease policy expert, and Hannah Murray, who's a Treat NMD's communications coordinator. So Vicky, Hannah, thank you so much for being able to tune in, and we're looking forward to hearing your presentation.
Thank you, Susie-Anne. So I think that you are going to give me control of your slides.
Yep, that's
Hopefully
correct.
this will go nicely and smoothly. If we do have any teething troubles, then please bear with us. We were planning to do this from our lovely bespoke conferencing suite in the university, and instead I'm doing this from my living. So Hannah and I are going to present to you for the next half an hour, and we wanted to tell you, as part of the Share4R series of webinars, about some initiatives, projects, activities that we think are interesting to the rare disease community and which people don't always know about. So the one that we're talking about today is a quite well-established initiative called the Resource on the State-of-the-Art of Rare Disease Activities in Europe. So I'll tell you a little bit about this and where it's come from, its different homes. And then I will summarize a little bit about one part of the resource, which is the overview report we do. And then we'll talk more for the rest of the webinar about some of the country-specific resources. So we'll tell you what we collect from countries and how, and a little bit about how it's presented and used. So if I can just go through, okay. Okay, so the resource has been around for a long time, and some of you, looking at who's on the call, some of you are very familiar with this resource, others have probably never heard about it. The state-of-the-art resource started life just over a decade ago, actually, and initially it was produced by the team at Orphanet, working at INSERM in Paris. So this is Charlotte Rodwell and Ségolène Aimé. And it was funded through a project called the USAID Joint Action. So we have loads of acronyms in the rare disease field, and the USAID was the European Union Committee of Experts on Rare Diseases. And this was the project that supported the birth of this resource. And it was initially published, printed as well, actually, as 5 big volumes, with around 500 plus pages. Some of these were like an overview of what's happening at European level around rare diseases in terms of policies and frameworks. Another report was all about what the Commission was doing, what the European Commission was doing, what the EMA was doing. And then there was a really long report all about what different countries were doing. So we fast forwarded to around 2015, and the USAID Joint Action was essentially replaced by another project called RD Action. And this was then the state-of-the-art resource migrated to Hannah and I at Newcastle. So Hannah was the person working with me on this back in the day. That's why I've asked her to talk a little bit about some of the data collection mechanisms that we put in place. And we changed the format a little bit of this, as I'll explain. At the moment, the current home for the project, it's never had a real home of its own, but the current home of the resource itself is a project called Rare 2030. Rare 2030, some of you will have heard about. It's actually what we call a foresight study. It's all about looking to the future, specifically to the year 2030, and in fact, quite a bit beyond, to try to think about what recommendations do we need today in 2020 to get us where we want to be in the rare disease field in 10 years' time. So in the past, we had some excellent soft law documents from about a decade ago, our Commission communication on rare diseases, followed by our Council recommendation. And a lot of what we see around us today in the rare disease landscape, in terms of countries having national plans, registries or not, and European reference networks, ERNs, a lot of that really was stimulated by this soft law from a decade ago. But there's very much a feeling that we need to be creating new policies, a new framework to help us guide to the future and address some of the challenges of that future. So at the moment, we're in this stage of the project. And those of you who are registered for the European Conference on Rare Diseases, ECRD, in just under 2 weeks' time, you will hear a lot about this project, because the discussions are going to be supporting our forecasting and our foresight. So this is the home at the moment of the state-of-the-art resource. If you go to the website, you'll be able to see what we have so far. And this is very soon going to be the home of a brand new sub-web page where we host all of this information on the state-of-the-art resource. So we're between websites at the moment, but that's going to be the new home very, very soon. We've been a little bit delayed by the COVID crisis. So one half of the state-of-the-art resource is what we call the overview report. Now, we last produced this a year and a half ago, and the next version is due at the end of this year. Even though it's a little out of date, in some ways, the material is not out of date, because what it seeks to do is to tell you about the origins of lots of the things that are happening about rare diseases in Europe. So this is a 100+ page report. It doesn't talk about disease-specific efforts, so what's happening in liver or eye disease, but it tells you about where our current policies, where some of our rare disease entities came from. It also tells you a little bit about the political framework, orphan drug legislation outside of Europe, so in various world regions. It's really useful if you want to know what European reference networks are and where they came from. If you want to know about concepts like centres of expertise and registries. It tries to give you a snapshot of what's happening in the research field. And actually, for this year's edition, what we need to do is to write a nice chapter on the Share for Rare project, now that we're starting to get some results and some tangible activities coming through. So if you keep an eye on the website, you will see this at the end of the year. But in the meantime, if you feel like there are things that you could know a bit more about on the European level, then this is a good place to start. The other part of the resource is the country data collection. So when Hannah and I inherited this, we made a few changes. In the past, we had expert groups, big expert groups, the USAID and the Commission Expert Group for Rare Diseases. And these were big bodies which came together 3 times a year in Luxembourg, and they would bring together member state representatives and others to talk about key rare disease issues. Now, we no longer have any expert groups, but in the past, it was the member state representatives from those countries who would really complete information on what each country was doing. So you would do kind of a tour de table in these meetings where France would share its updates, the UK, Poland, and we'd go around. What we wanted to do for the state-of-the-art resource when we took it on was to open that up and to include some other actors providing information on what each country was doing, just to make it a bit more democratic, but to get different perspectives in there as well. So today we set up what we call data contributing committees for each of the EU member states. And so far we've been focusing quite a lot on the member states. We will be expanding a little bit more this year to include some other European countries. So most of our countries have a little committee made up of some sort of semi-formal representative from a Ministry of Health or Ministry of Research. We try to have somebody from the National Orphanet team. We try to have a representative of a National Patient Alliance, so one of the umbrella alliances for your countries. And we also now include, at least in copy to the messages, the officials from the member states who oversee the European reference networks. So that's the idea. And what we ask them to do is to provide information on what's happening around rare diseases in their country. And we ask them to do that in a particular way and for particular reasons. So Hannah, maybe you can tell us a little bit about how we decided what to ask countries and what we collect.
Thank you, Vicky. Yes, so both the USAID and the Commission Expert Group for Rare Diseases published a number of recommendations on various topics within the rare disease field. And interestingly, if anybody would like to access any of these documents displayed here, they can actually be accessed through the state-of-the-art overview report, which Vicky has previously mentioned. One set of these recommendations was produced on the topic of national plans and strategies. And this document contained a table of particular data points which each member state had agreed to collect on an annual basis. And it was these particular data points, as well as what had been asked in the previous Joint Action Survey, which allowed us to develop our new state-of-the-art online survey. So as you can see from the list, the survey would need to ask a number of questions on many different topics, very broad topics. So you'd look at national plans and strategies, you'd also look at rare disease registration, the definition of a rare disease. Does a country use the EU's definition or does it use another particular definition? But all of these topics were important to consider because it's only through considering all of these things, all of these areas, that a robust approach could be found to tackle the challenges posed by rare diseases. And as you can see, there's a link there also which will take you to the full list of questions within each of these topic areas. So as you can see from this slide, it shows a snapshot of our tree of questions. Each question was mapped in this way to enable us to craft pathways for the responder. We wanted to make answering the survey as efficient and as streamlined a process as possible. The survey we try to tailor it according to the responses provided by the user higher up the tree, as it were. And as you can see from this slide, the answer options in blue are closely aligned. There we go, yeah. The answer options in blue are closely aligned with the options the expert groups built into their recommendations, which is, as you can see from this other picture, in the second column. So we were trying to match things incredibly closely. I mean, one of the positive aspects of using this kind of alignment is that we are not asking member states to provide anything additional. It was just what was promised when these recommendations were first adopted. Yeah, so this slide shows you what the user interface of the survey actually looked like and demonstrates how our data contributing committees are able to navigate their way through the survey. Vicky and I went through an extensive process of assessing the available online survey tools at the time to find the one that would meet our needs most effectively. And this particular survey platform, Lime Survey, has many many benefits. You can translate your survey into multiple languages. You can apply logic, which means that you can carve your user pathways and only show what is relevant to a particular responder. Rather than having one link to the survey, you can create individual links for each data contributing committee. And the benefit of this is that you can ensure all members of the DCC have access. Members can then save their responses and come back to them at a later date. And I think that when you are trying to ask people to complete something which is so complex and so vast, and you're asking for so much information, that having something which can impose a form of drafting and revision is a really important option to offer. But as you say, we are asking for so much data, and it's incredibly important that every member of the DCC has an opportunity to move through, to answer questions, and to be able to revise how they've responded. When designing the survey, you are always looking to make the process of responding as efficient as possible. And to do this, you use different answer types. So for example, we have multiple choice radio buttons, we have tick boxes and free text comment boxes. When it comes to analysing the data you've collected, obviously you collect masses and masses of information, and the mix of answer types provide us with comparable data where we can create graphs and charts for our reports from the MCQ questions, for example, but the free text comment boxes also give us with a more in-depth analysis from our responders. So each member of a data contributing committee receives the same link to the survey, and how they complete the survey is completely up to them. They can either all complete all sections or agree that one person completes certain sections first. And this obviously allows you to share the workload. Members can focus on perhaps their own individual areas of expertise. But fundamentally, what we're trying to do through using Lime Survey was enable the DCC to provide a multi-stakeholder perspective on each topic, which perhaps couldn't have been achieved with other survey platforms, or perhaps if the survey had been in a paper format. So thank you. I think I'll hand back to Vicky.
Okay, so what do we do with the data? This is our million-dollar question. So at the moment, I'm afraid we're a bit between homes. As I said, throughout its decade of life so far, the state-of-the-art resource has never had its own site, its own area. We're hoping this is going to change after this year. So at the moment, if you're desperate to get your hands on the older reports, you can find those on the old RD Action site. But I'm promised a new section of our Rare 2030 website where you'll be able to see all of these documents. So you will be able to go on there and find all of the country flags. You've got to know your flags quite well. And then you'll be able to access a sometimes quite lengthy report for each country. And then we'll also produce a summary as well of what's happening, a snapshot. So as Hannah said, we collect information on what's happening at the national level across all these different areas. So we want to present that. However, the last data collection that we did from our excellent data contributing committees was in May last year. And what we need to do now is to update all of these national reports so the countries can find these and stakeholders can access them and read them. I'll give you a quick glimpse of what one of these looks like. So we've just authorised the UK one. Hopefully this will work. Let me see. I'm not going to go through all this. I'm just going to show you a snapshot of what they look like. So they go through the different sections. So we talk about the definition. We talk about the situation and the status quo around national plans and strategies, which is something that I'm going to come back onto in a moment. We go through all these different areas corresponding to the headings that Hannah showed you. So this one, I can't see how long this one is. Most of them are about 8 to 10 pages. Italy is significantly longer because we always have lots of data from Italy. But we'll be producing these very soon. We just need to get approval from the individual countries and get the page set up on the Rare 2030 site, and then we can show them. What we have done with the data last year, though, is something really, really urgent. So actually, instead of focusing on country by country by country documents last year, we focused on putting together data on each of those topics and analysing it across the countries. And we used that, I hope, to some good effect in the Rare 2030 project. So let's see if this lets me get to the Rare 2030 website. So the Rare 2030 project, what we did last year was we set up what we call a panel of experts, which is around 200 people from all different stakeholder backgrounds. And you can find out about these individuals. We actually have some of them on the call, which is great. on the webinar. And we wanted to get them brainstorming about our status quo for different rare disease topics. So we roughly grouped all of these people into 8 subgroups around quite broad headings like data collection and utilization, diagnostics. And for each of those, we created a background document that we call a knowledge-based summary. It's kind of a food for thought document. And again, they are disease agnostic, so they're not telling you about what's happening in metabolic or neurology. They are intended to give you kind of a cheat sheet to show you what's happening at the European level. So they always start off by introducing the topic, and they try to summarize any relevant policies, past recommendations that we have, because sometimes we have recommendations, we have policies on a topic agreed often at European level, which we just don't know about. So people start reinventing wheels, or they don't use these things at the national level for their advocacy because they don't know they're there. So we talk about all the policies, and we also present in these documents various outputs. So for this one, there was a drive from the patient organisations around undiagnosed diseases. So we capture these sorts of documents. I'm not going to go through all of this because there's masses of stuff in here. But if I scroll all the way down, what we did was we tried to inject some pieces of analysis from the state-of-the-art resource just to support our discussions in this panel so that we know where we're coming from. You can't really know where you're going to in terms of what policies you want and you need if you don't know what your current realities are. So here, for instance, we included some of our statistics around newborn screening. We created nice charts and maps, which I'm going to show you in a second. So don't worry if you can't see it on here. So that's really what we use the information for. And you can check out all of those 8 knowledge-based summaries through this link. So for the rest of this session, which I think is probably about 10-15 minutes, I'm just going to tell you a little bit about some of the data, the most recent data we have from last summer around 2 key topics. So one of them is national plans and strategies, and the other is newborn screening. For national plans and strategies, all countries have cancer plans, or have had cancer plans in the past, to explain how they're going to address the needs of people in their jurisdiction facing the challenges of cancer. And well over a decade ago, it was decided that actually this would be a really good thing for countries to develop for rare diseases. We had some real front runners, countries like France, which already had national plans for rare diseases, and that was a really good example for the rest. So that really important soft law document I talked about earlier, that's the Council recommendation on an action in the field of rare diseases from 2009. That document called upon all of the EU member states, and it asked them to elaborate and adopt a national plan or strategy for rare diseases by the end of 2013. Now, at the time when this was requested, only 5 countries had these, 5 member states had these. As of last summer, 25 member states had adopted a national plan or strategy at one time or another. And that sentence, at one time or another, is really important because 10 years ago, the quest was very much to get countries writing these documents. Now, the quest is really to see if countries are actually doing anything with them. Are they being implemented? Are they sitting on someone's desk? And also to encourage countries to keep assessing these and to renew them and to create new plans. Because as you can hopefully see by scrolling a little bit here, we have, surprise, surprise, quite a lot of variety across Europe. So we have a few countries who have not yet adopted a national plan or strategy. But of those who have, a few of them adopted plans and strategies without an end date. So usually you'd adopt a plan from, say, 2014 to 2018. A few went for more open-ended plans, but of the countries which did adopt time-bound ones, quite a lot of those, when you got to last summer, and even more now, actually had expired. So essentially, their first plans were no longer. So at the moment, as I said, we've had 25 countries have adopted one at some point. Out of the 20 member states which adopted these time-bound, so date-bound plans or strategies, Austria's became open-ended. 7 of these, as of last summer, seem to have expired and not to have been replaced. Now, there may have been slight changes in some of these. I know certainly Finland and Italy were working very closely. So some of these countries have actually expired. And a quite sobering fact is that if you think about plans that are going to be active beyond 2020, only France and Luxembourg are going to have active plans post 2020 at the moment. So that's really quite a concern for us, because a good national plan or strategy should be able to spell out everything a country is doing around national plans and strategies. So if we don't have these, or if they're there only in word alone, they're not really very useful to us. We collect more than just whether a country has a plan or strategy. We try to see if any of them have any budget behind what they're doing. Now, these are quite a difficult answers to check up on and to interpret. But from our data last summer, of the 18 plans or strategies still going, still active, only 4 of them reported having any dedicated budget to support what was happening. And sometimes that's a very small budget indeed. We also try to look at whether there's any kind of body or group in place to drive home that plan or strategy. Because like I said, what you don't want is just for a minister to rubber stamp a plan and then it sits in a drawer, sits on a desk, and nobody's actually implementing it. So one way to try and get that implemented is to have a group that is very transparent, that isn't just some ministry people in a closed room, but that includes clinicians, includes researchers, but importantly also includes patients. And again, we asked if people were in those groups and if they were meeting regularly and they were functional. You could see that, again, we have a real mixture. So in 8 cases, out of those 18 member states with still active plans that we could analyse, in 8 of those cases, it was reported that there is a group, it is meeting, it is functioning well, it includes patients. But for others, it's a little bit more murky. So we really need to think about how in Europe we can try to build up some momentum again. It's very difficult because we don't have expert groups as we had in the past. We don't have a place where countries have to come together and their official representatives have to say what they've been doing for rare diseases. And that kind of informal peer pressure, I think, was really helpful in the past. The other topic that I just wanted to highlight, again, to show the sort of variety, the heterogeneity across Europe, is the topic of newborn screening. So newborn screening is not diagnostics exactly, but that's where we put it in terms of the Rare 2030 Food for Thought document. Newborn screening is around detecting people who are at particular risk, and then you would confirm a diagnosis with a proper laboratory test. But newborn screening for a long time has been done for conditions like phenylketonuria. So these are diseases which are screened for in the first hours or certainly days of life, and you do it by a heel prick and a blood spot for a newborn baby. And the idea is that there are conditions, especially metabolic conditions, but by no means only, which if you can address these and find these patients early enough, there are things that you can do, whether it's treatments or whether it's dietary therapies, things that you can do that can prevent disastrous damage. But if you leave it too late, if you were to diagnose that patient, several months or years into their life, actually you can perhaps never reverse the course of that disease. So it's really important to screen all of those populations, all of the babies born in those hospitals all across the country, to try to pick up those cases, even if it's a very small number of cases relative to the general population. Now, as always, our European countries control their own healthcare systems. So Europe doesn't force them to do anything here. They make their own decisions on their services and how they spend their funds. And they make their own decisions on what diseases they screen for, what they include in their newborn screening programs. And unsurprisingly, we have huge variety. So we have quite a few countries which screen for between 1 and 5 conditions. And I have to say, again, this data is from last summer. Quite a few countries are assessing this because this is a really hot topic. As science is moving forwards, it's opening up the potential to screen for many, many other diseases. And that raises all sorts of difficult questions, legal questions, ethical questions, but also economic questions, because the traditional view is that you'd only screen for a condition if there is a therapy in place for that condition. And if there's a therapy there, are you going to be able to actually access it no matter how much it costs? But again, you can see our disparity that we have. So some countries, quite a few, only screen for 2, 3, 4, 5 conditions, but it goes right up to quite a lot of countries screening for over 20 conditions. So this is where my geography is tested. So we have Finland, Sweden, countries like Portugal, Slovenia, Slovakia, Hungary, always very high up there. Austria screens for a lot of conditions, and Italy, in a way, screens for most. Now, Italy is difficult because, of course, it's made up of regions, and there's still a relatively small number, at least there was last summer, of conditions that are screened for mandatorily, so that have to be screened for at the national level. But the regions make some of their own decisions, so some of the regions are actually screening into the 50s of conditions, which is relatively really very high. So this is just a real snapshot of the countries from sort of highest to lowest, with some of the comments on here. There are still a few countries that we need to chase data for this, because for one reason or another they couldn't get hold of that data when we asked them last time. So we'll be going back to them in the next couple of months to ask for new data. And this takes us down to the ones at the bottom. Now, I was talking to an expert in newborn screening about this yesterday, in fact, because like I said, this is a really hot topic at the moment. It doesn't necessarily follow that numbers are everything here. So it may be that a country screens for a relatively small number of diseases, but they have a really good system in place to explain why they've made those decisions, and they perhaps ensure a very high quality of care for the patients that are detected. Theoretically speaking, a country could screen for more, but perhaps have less of a methodologically sound reasoning for that, maybe have less of a structure in place to actually provide the care that then is necessary. So it's not all about numbers, but I think that the disparity that we do have and the variety is something that at least is worth opening up the debate about and looking at what we could do to perhaps harmonise, if that's not a dirty word, harmonise something across Europe here, even if it's only explaining why countries have selected the conditions that they have. So to sum up, I've only shown you a snapshot of the different sorts of data that we collect here. I think for me, the good thing about this resource is that it gives us hopefully clear and accurate perspectives and data on the realities of addressing rare diseases and living with rare diseases in all of our countries. And what you find is that actually, no country is wholly brilliant or wholly bad. There are positives, there are things that each country does really well. And I think it's a great opportunity, this resource, to help countries learn from each other. And we'll be thinking about how we can do that more in the coming months and years, and really identify some good practices that countries are doing through this data, even though we don't have the systems in place and the expert groups that we used to have. Hopefully, by having these data contributing committees in the country, it's getting people working together and speaking together who maybe didn't work so closely in the past. It gives you the chance to bring together the data horizontally, as I've just showed you, hopefully, to give you an idea of what's happening at the European level. And that hopefully makes it much easier to do some sort of lobbying and advocacy, whether that is in your own country at the national level to say, look, this is what other countries are doing here, this is where we are, this is something that we need to look at, or else to congratulate yourselves and say, hey, we're doing brilliantly here, we're leading the field. But also in terms of stimulating ideas for new research and new activities, whether they are activities for patient organisations or for European reference networks or for others. So the structure will be changing from the resource next year. We're going to be expanding this out in quite a new, exciting way. So we'll be communicating those plans later in the year to all of our data contributing committees. For now, though, stay tuned for the Rare 2030 website, where you will see map by map your country becoming available, their report becoming available. We'll be tweeting about that as each one goes online and is approved by the authors. And then this summer, all being well, we will reach out again to our committees from each of the countries so that we have brand new data in the autumn, which we can then publish very, very quickly, ready for the end of the year. So we have as up to date as possible a record of this, because actually, as you'll all appreciate, one of the most challenging things with this kind of resource is keeping everything up to date. So I think we will end here, and it may be that some of you or all of you have any questions or comments either on the resource or on any of the topics that we talked about, or anything else that springs to mind, and we'll be happy to try to help with those.
All right, Vicky, Hannah, thanks so much for this presentation and the explanation of the resources. I think it's so nice to see that all these insights about rare disease activities can be applied across all rare disease fields. So this really strengthens the whole rare disease voice. And for now, I'd like to wish everyone a very nice evening and hope to see you soon again.
Thanks, Suzanne. And if anybody wants to send any emails or comments, then they can do. My email address is on the slides and you have all of those.